Roles and functions of directing, presented by Narisa G. Kempis, RN. There are four components of directing. These are motivation, communication, delegation, and conflict management. Directing is coordinating, activating, doing phase of management. Managers direct the work of their subordinates and sets the plans into action. The first component is motivation. It is the force behind the individual that influences or directs behavior. There are two types of motivation: intrinsic motivation and the extrinsic motivation. There are also motivational theories like Maslow's hierarchy of needs, B.F. Skinner operant conditioning and behavior modification, Herzberg motivation hygiene theory, Bloom's expectancy model, McClelland's achievement affiliation and power, McConnell positive reinforcement, and lastly Mannion's pathway to joy. Professional support systems for the manager includes: manager should be positive, enthusiastic, internally motivated, monitoring of their own motivational level, self-care, and must be able to separate professional and personal life. Questions: what motivates you in life? How are you motivated? Who motivates you? And give some examples on how you can motivate your subordinates. The second component would be communication. It impacts all management activities and cuts across all phases of management process. Most critical leadership skill must have excellent interpersonal communication skills, and the ability to communicate effectively determines the success of a leader or a manager. Communication process includes the sender, the message, and the receiver, and factors affecting communication would be the internal climate and the external climate. Organizational communication strategies. Number one, assess organizational communication. Two, understand the organizational structure. Three, communication is not a one-way channel. Four, communication must be clear, simple, and precise. Five, senders should seek feedback. And lastly, use of multiple communication methods. Channels of communication includes upward communication, downward communication, horizontal communication, diagonal communication, and grapevine communication. Communication modes includes written, face-to-face, non-verbal, and telephone. Verbal communication skills: passive communication, aggressive communication, passive-aggressive communication, assertive communication, listening skills, the most important for a manager to develop. Questions: how do you communicate with others? What is your style of communication? And give some examples of problems you encountered in communication and how you resolved it. The third component would be delegation. Delegation is getting work done through others, directing the performance of one or more people to accomplish organizational goals. According to ANA, it is the transfer of responsibility for the performance of a task from one person to another. And according to NCDSN, they define transferring to a competent individual the authority to perform a selected nursing task in a selected situation. Common delegation errors includes: number one, under-delegating, not delegating tasks to the subordinate. Two, over-delegating, overburdening the subordinates with tasks. And number three, improper delegating, delegating at the wrong time, to the wrong person, or for the wrong reason. Steps to successful delegation includes understanding the principles of delegation, the ability to communicate clearly, the capacity to see the value that delegation has in developing others, building trust and self-esteem, recognizing that different personalities and capabilities exist. Acknowledging the following: the right person, the right task, the right circumstances, the right direction and communication, and the right supervision and evaluation. To delegate or not to delegate. Tasks that can be delegated after considering patient's condition or the stability of the patient capacity for self-care, complexity of task, repetitive nature of task, skills and experience of UAP, medical technology involved, infection and safety precautions involved, RN supervision available, environment and potential for harm. Tasks that can be delegated: answering phones, cleaning up the procedures, patient transportation for stable patients, ordering supplies and other clerical tasks, stocking procedures and exam rooms, assisting with procedures, data collection without analysis. Tasks that cannot be delegated: any tasks that would involve nursing judgment or sophisticated application of nursing process like initial assessment of new patients, assessing pain, teaching injections, evaluating success of a treatment, interpreting test results, establishing plans of care, triage, counseling, and teaching. The fourth component would be managing conflict. It is the internal and external discord that results from the differences in ideas, values, or feelings between two or more people. Too much conflict results in organizational stasis, while too much conflict reduces the organizational effectiveness and immobilization of employees. Categories of conflict. Intergroup occurs between two or more groups of people, departments, or organizations. Intrapersonal occurs within a person. Interpersonal, also known as horizontal violence or bullying, happens to two or more people with different values, goals, and beliefs. Conflict process: latent conflict, the antecedent conditions; perceived conflict, conflict is internalized; felt conflict, affective conflict or the emotions; manifest conflict, overt conflict or the actions; conflict resolution, conflict management; conflict aftermath or the when it can be positive or negative. Common conflict resolution strategies includes compromising, cooperating, accommodating, smoothing, avoiding, and collaborating. Common causes of organizational conflict includes poor communication, inadequate defined organizational structure, individual behavior, incompatibilities or disagreements based on difference of temperament or attitudes, unclear expectations, operational or staffing changes, diversity in gender, culture, or age. Nego- Negotiation. These are collaboration, compromise, each party gives up something, and the emphasis is on accommodating differences. People have conflicting needs, wants, and desires that must be constantly compromised. The end goal is a win-win situation. Before, during, and after the negotiation. Before, be prepared mentally by having done your homework. Determine your starting point and bottom line. Look for hidden agendas, both your own and the parties with whom you are negotiating. During, maintain composure. Role model good communication skills by speaking and listening, assertiveness, and flexibility. Avoid using destructive negotiation techniques like ridicule, inappropriate questioning, and flattery, but be prepared to counter if used against you. After, restate what has been agreed upon, both verbally and in writing. Recognize and thank all participants for their contribution to a successful negotiation. An effective negotiator always appears calm and self-assured. Closure and follow-up are important parts of the negotiation process. Questions. Give some example on how you manage conflict in your work or personal life. What are the strategies you use to resolve the conflict? References by Marquise Bessie, Leadership Roles and Management Functions in Nursing, by C&E Publishing Inc., Philippines, Maxwell John, 21 Indispensable Qualities of a Leader, Thomas Nelson Publisher, USA. Acknowledgements, Dr. Annabel Borromeo, Ms. Ena Nunez, and Mr. Craig Paraino. Thank you and God bless.